Hi, Caroline. Nice
Hi.
to meet you.
How are you?
Good. How are you?
Good.
My name's Mackenzie. I'm a family nurse practitioner student at George Washington
Okay.
University. I'm going to be doing your physical assessment today. Okay. So I'm just going to clean my hands here. Today I'm going to be listening to your lungs, your heart. I'm going to be feeling some pulses, and I'm going to be assessing your abdomen as well.
Okay.
Okay. So I'm going to go ahead and start with your lungs. So I'm just looking for a regularity in your breathing, looking for any use of accessory muscles or asymmetry, but everything looks like you're breathing just fine. I don't see any use of any extra muscles or anything like that. And so now what I'm going to do is I'm going to go ahead and just palpate the area. I'm going to start with your front, and I'm just looking for any subcutaneous air that you might have up here. Looking for any issues with your ribs. Do you feel any tenderness?
No.
Great. Everything feels good so far. And so what I'm going to do is I'm going to place my hand in various spots.
Okay.
And when I do, I'm going to have you say the word 99.
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
I'm just going to go on your side. If you could lift your arm.
99,
And same over here.
99.
Perfect. It feels equal on both sides. which
Okay,
is
great.
Can I have you go ahead and swing around to
Yep.
the other side of the table? I'm just going to look at your back. I'm also feeling for any irregularities with your rib cage. But everything feels nice and strong. Don't feel any tenderness or see you cringing at all. So the next thing I'm going to do is I'm going to
you by taking this off.
Sure. I'm going to feel for expansion of your lungs. I'm going to wrap my hands around your back and I'm going to squeeze in. You could take a big deep breath and relax. Perfect. So my hands move nice and symmetrically on both sides, which is great. And so now with your back here, I'm going to go ahead and start the percussion. So I'm going to percuss various parts of your lung fields. Just listening for a nice resonant tone. And your sides as well. Perfect. Nice and resonant there. You could go ahead and swing back around for me. And I can move a lot today. I'm going to press your anterior lung as well. Good. Nice and clear there as well. So I'm all finished with the percussion part. I'm going to move on to listening. So I'm going to listen to your lung fields in the front and the back. So every time I touch my stethoscope, if you could just take a big deep breath.
Okay.
Great. If you could lift this arm for me. I'm going to move to this side. Lift this arm for me. Great. And now listen to your back now. If you could swing back around the left side. Go ahead and take a deep breath. Okay, so I'm done listening to your lung fields, but now I'm going to have you do some speaking. So every time I touch my stethoscope, if you could say the letter E. E, 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 E. Perfect. And this time, if you could say whispering 1, 2, 3. Okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, Okay, go ahead and swing back around one more time. Sorry if you're moving. I'm going to do the same thing on the front, so now if you could just say the letter E.
Okay. E, 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 E.
What's your arm look for me? Say E.
E,
On this side.
E.
Perfect. Now if you could whisper 1, 2, 3 again, okay? You sound great. Everything in your lungs sounds nice and clear. Everything looks great there. I'm going to go ahead and move on to your heart.
Okay.
Okay, so what I'm going to do is I'm actually going to have you rest back. So I'm going to move the head of this up a little bit. If you could press back, and I'll pick up your feet. All right, perfect. And I'll have you turn your head to the left, okay? So I'm going to be looking for any distension in your neck, which I don't see anything up here. I'm looking in your sternal notch, and I do see a little bit of a pulse there, which is normal. Looks good. And I'm going to go ahead and listen to your carotid arteries as well, okay?
Mm-hmm.
Great. Okay, now I'm looking for any visible pulsations or thrills in the chest, which I don't see any of. So I'm going to try and find the point of maximal impulse. I'm just going to be feeling around this area
Mm-hmm.
and your costal margins. So I'm not feeling anything there. So I'm going to have you turn to your left if you don't mind.
Yep.
Go ahead and flip over for me. Your whole body. You can just turn towards me.
Oh, wait.
Yeah, perfect. I'm going to fill the same spot. Okay, so I do feel a pulse there, which is great.
Okay.
And normal, so that's perfect. You can go ahead and rest back to your back. Okay, so I am all finished with the palpation part there. I'm going to go ahead and start to listen to you. I'm just going to listen to a number of areas on your chest, both on both sides of my stethoscope. I'm just going to lift up the bottom of this sports bra just slightly.
Mm-hmm.
And one more time. All right, now I'm going to listen with the other side. And pull down just a little. Okay, great. Now I'm going to do the same thing, but I'm going to have you sit up for me. So go ahead and sit back up. I'm just going to continue to listen to your heart. You got a good strong heartbeat. I didn't hear any murmurs or anything that was abnormal.
Okay.
So I'm done with the cardiac exam. I'm going to move on to the peripheral vascular exam.
Okay.
So for this, I'm going to have you stay still while I bring this back down. Perfect. Now I'll have you rest on back onto your back. So the first thing I'm going to look for is any irregularities with your skin. So I'm going to be looking for any changes in temperature, hair dispersion, or anything that's out of the ordinary. Okay, so I'm just going to be feeling nice and warm, not cold, not sweaty, which is good. Feeling your legs, nice and warm. See your hair is evenly distributed across.
Mm-hmm.
I don't see any big scars. You look like you fell or something on your
Yeah.
hair. Yeah. Have you had any issues with swelling at all on your
None.
legs or ankles?
Nope, nothing.
I'm going to check your capillary refill on both sides.
Sorry, my hands are freezing.
That's okay.
That's baseline.
Everything looks nice and brisk, which is good. Good blood flow there. Okay, so now I've
Great.
done, sorry?
I said great.
Oh, good. So I've done the inspection part, so now I'm
Okay.
going to go ahead and I'm going to begin to palpate some of these areas, okay?
Okay.
So I'm going to check your carotid pulses. Brachial pulses.
Mm-hmm.
bend this arm up to a 90-degree angle. Don't feel any lymph nodes there, so that's great.
Okay.
Okay. I'm also going to check behind your knee. If you could bend your knee up for me. Feeling for a pulse, which should feel nice and strong. We don't feel any swollen lymph nodes there.
Okay.
Your foot. Good strong pulse. I'm just going to swing around to this other side. Good strong pulse in your foot. I'll be careful with your knee, I promise.
Should have a bandage on it.
So good strong pulse. I don't feel any swollen lymph nodes there. I'm also going to check your femoral artery pulse here. Nice and strong. Now I'm just going to listen to a few spots.
Okay.
Okay? Listen to your aorta for any sounds I hear that are abnormal. Femoral arteries. And here's your iliac and pelvis. I'm going to go back on the same spot, so with the other side of my stethoscope.
Okay.
Okay. So I'm not hearing much of anything, which is
Okay.
good. Okay. So I'm all finished with this part of the exam. I'm going to move on to your abdomen.
Okay.
So first, I'm just looking for symmetry. I'm looking for anything that would indicate any ascites, which is a fluid buildup. Looking for any scars or anything, but your tummy is nice and flat. I don't see any scars. It looks symmetrical.
Hasn't been bothering me.
Great. So what I'm going to do next is I'm going to move on to the auscultation part. So I'm going to
Okay.
listen for your vowel sounds.
Okay.
Okay. And there's 4 places I'm going to listen for those. Very good vowel sounds there. I'm going to just listen over your liver and spleen.
Mm-hmm.
Perfect. Okay, so I'm done with the listening. So I'm going to go ahead and begin to percuss the area. So what I'm listening for is any sounds of gastric bubble, looking for any sign that there's any fluid buildup in your belly, okay? Everything sounds good there. I'm going to try and percuss down for your liver. And so what I'm going to do is I'm going to start right in this area here, and I'm going to I'm going to percuss down and try and feel the borders of your liver. Okay. Okay. So right about here is where I would mark that line. So I'm going to go ahead and feel a little bit closer to the medial side here. Okay. Perfect. So your liver is right about here. It's perfectly normal range. Now I'm gonna try and feel it, okay, at the end. But now I'm gonna move on just a regular palpation of your belly. Start nice and light. Any tenderness there?
No.
Good. Okay, go a little bit deeper. Don't feel any massive or anything out of the ordinary. Are you able to lift your head up for me?
Sure.
Perfect. You can put it back down. So I don't see any signs of herniation or anything like that. Your belly feels perfectly normal. And so now I'm going to try and feel for your liver. So I'm going to put my hand here. So you can go ahead and take a big deep breath in and relax it out. Perfect. Not feeling anything. I'm going to come on this side and try and feel your spleen. Go ahead and take a big deep breath in. And out. Perfect. I don't feel anything there
Okay.
either. So I'm all finished. Go ahead and sit back up. One last thing I'm going to do is I'm going to check your diaphragm. Okay, so if I could actually have you spin around to the other side, I'm just going to be feeling for where it is when you breathe in, when you let it out. So if you could take a big deep breath in and hold it for me. So right about there.
Mm-hmm.
Go ahead and let your air out. Take another deep breath and hold it. I'm going to do it on the other side. Okay, right about here on both sides. Let it out. One more time, I'm going to have you take a big deep breath and relax all of that air out. So right about here. And right about here. So perfect. You've got just a couple centimeters of movement, which is perfectly normal.
Okay.
Okay. So everything I've seen so far looks pretty good. You can swing around to the front. Do you have any questions or concerns for me? Nope. Okay. Well, then I'm going to go ahead and be done with the assessment now.